I'm Scott Starratt with Starratt Wealth Management. So today I'm really blessed to have a fellow here who I met not that long ago. His name is Dr. Charles Wong, and Charles is an emergency physician, but he's also the founder, and why he's here to talk today is he's a founder of HomeFree Homecare. And so home free is a little unique in that it's medically supervised home care. And we'll talk a little bit about what that means. But it's essentially a novel system of providing home care for that he found from his years of working in the hospital, that there seemed to be that medically supervised side that was missing. So Charles believes that aging at home is very important, and that medically supervised home care, it's not only a solution for families and for his clients, but it's also something that can be done to manage the, over capacity issues that our healthcare system has. So thanks, Charles, for joining us. This is great.
Thank you so much for having me, Scott. I appreciate it.
So, Charles, let's get right into it. I mean, one of the things, that I kind of just talked about was, medically supervised home care versus non-medically supervised. But really, how did you get into this business? Being an ER doc is quite a different role compared to home care.
Yeah, thanks for asking. That is really the underlying ethos behind what home free is, which is actually my experience as a ER physician in the hospital. So over a decade or so of seeing patients coming in over and over again with medical complication, often surrounded by families struggling with looking after their loved ones at home, we just found that there was a complete absence of what I felt to be adequate, if not good, outpatient or home services to keep patients thriving at home. And the existing services that are out there just didn't do the job of keeping patients at home. Otherwise, we wouldn't be seeing them on a repeated basis in the hospital. And so I thought that this is something that I could help to do. I've always been interested in entrepreneurship, and thankfully, I came across two really great partners who had the same vision in their mind of helping people. They experienced this problem on their end as patients in the system where they were very underserved by the existing options. And we came up with this product, this service that we call medically supervised home care, to really meet a gaping need in the healthcare infrastructure, which is a sort of home care that is managed and has the accountability system of real healthcare, like in a hospital or in a facility. In other words, managed by doctors and nurses with experience and expertise in keeping patients healthy. And combining that with the business expertise and the infrastructure to actually deliver this inside of people's homes, which is the challenging and interesting part.
Hmm. So let's take a step back just for a second. And, you know, I mean, talk about a little bit about the state of home care, kind of in Calgary, but more importantly, really Alberta, kind of where do you see, again, from, your experience, like you say, as an entrepreneur, but also what you see coming through the ER on a daily basis. Like, where do you see the home care kind of industry right now?
Yeah, this is a really great question because a lot of people don't think of home care as a very sexy sort of topic in the news or in what they read about healthcare in general. But it's actually at the crossroads of all the biggest problems that we're encountering as a society and as a health system. So we've heard of ER overcrowding, people even dying in emergency departments waiting for care. We've heard of patients waiting to get in line to go to nursing homes, which nobody wants to go to, by the way, or very few people would prefer to go to. And home care is actually the obvious solution to both of these things. And it's a little bit of like a neglected area of healthcare that's really been underinvested in. And part of the problem is that there's this assumption of what home care is and it isn't. And so to answer your question, the existing state of home care as I see it is that it's been a race to the bottom. And what I mean by that is home care as an industry has somehow gotten into their heads that the best way to deliver home care is to hire the lowest cost possible provider and provide it at the highest volume possible. In other words, really low quality or cheap care. And the problem with that is sort of obvious. Like the consequences of cheap care are medical complication, patients not thriving at home and ending up in much more expensive, more complicated, and less dignified care in facilities. And so we came about this kind of the opposite. Instead of providing low quality care at home, we decided that we would flip the script and the formula and provide higher quality care. Yes, costing a little bit more upfront, but saving our system and as well as families actually a lot of money over longer periods of time. And lo and behold, we do a much better job of keeping patients at home, which actually saves them money because the alternative of going to facilities is actually a very expensive proposition for most people. People don't appreciate actually how expensive facilities are until they actually have to face this decision on their own. Even what I would call a low end shared bed public nursing home or assisted living facility costs out of pocket more than $2,000 a month. And private facilities, the sort of nice places that people imagine themselves going to, are easily in the $8,000 to $10,000 a month range. And that's just for basically rent and food. It doesn't really include much healthcare support. So that's the industry that we came into. And our approach to it was to do the opposite. Instead of providing low value care, provide high value, slightly more expensive, but in the long run, less expensive care.
So I'm a money guy. And lots of people, say, well, I'm concerned I'm gonna outlive my wealth.
Hmm.
And so obviously at $8,000 to $10,000 a month, that could be, especially if you have a chronic illness, but not something that's going to get you in the end. That could possibly happen. So when you say you're a little bit more expensive, obviously you don't have to worry about the food part and the home part because that's already dealt with. So what really does the home care industry or you in particular provide? And when you say a little bit more expensive, are there ways you can get that cost down? Like are there subsidies? Can the government be involved? Those type of things?
Yeah, I'll answer that question in two parts. The easier part to answer is the subsidy question. So thankfully, our government and health system has actually come up with a program called Client Directed Home Care Invoicing, or CDHCI. This program basically allows a patient to transition their home care funding, which would be otherwise delivered by the regional health authority in the sort of typical way, which is low cost, low quality, and convert it into a dollar amount that they can direct to a private provider. Therefore, our services as a private home care company can be our private services can be publicly funded up to 75%. So out-of-pocket costs working with HomeFree are as low as $150 per week, but it can go up according to a patient's funding qualification as well as how much need they have. Now, the other question, a little bit more of a complex question, is why home care can be more affordable than going to a facility. And the answer to that essentially is redundancy and efficiency. So going to a facility, just to use that kind of the common alternative that people are thinking about when they enter the stage of life, represents a lot of redundancy. Like if you're currently a patient struggling with, let's say, Parkinson's disease in your own home, you already have a bathroom, you have a roof over your head, you have a fridge, you have, all the cutlery and things that you need to live. You just basically living at home just costs you groceries and utilities. But if you go to a facility, it'd be a lot like living at a home and then going to a hotel. Suddenly you're paying for a common area, you're paying for cleaning staff, you're paying for lights, you're paying for a new refrigerator, all these things. And so you're paying to go to a hotel when you already own a home. And so for a lot of people, that actually that decision actually represents the choice of selling their home, often a person's main source of savings in their senior years, in order to facilitate going to a hotel. So if you think about it as the financial decision of selling your home to move into a hotel, most people would immediately see that as a very, not a very smart financial decision. Whereas the alternative of just plugging the very specific healthcare needs that you have inside of your home while keeping everything the same is actually very efficient. So a lot of people who need or imagine themselves needing, and I'm doing air quotes for those of you who are only listening, a facility, think that they need 24 hours of care. But if you think about it, nobody really ever needs 24 hours of care. What they really need is care at the moments that they need it. And for a lot of people, that's their morning routine, their evening routine, when they take their medications, and maybe a bath in the middle of the day. And so we're able to provide or plug those specific holes in care for people. So people who imagine themselves requiring 24-hour care actually, in many cases, only require either 4 or 8 hours of care. And that's how we're able to eke out a lot more efficiency with home care rather than going to a facility.
So to play devil's advocate a bit, one of the things about a facility, and let's assume it's a nice one, is that there's people around all the time. And I don't
Mm.
necessarily mean, other residents. I mean, there's nurses there, theoretically. There could be, there could be a doctor from time to time. There's obviously home care aides of some sort, so if you need help, they're there. How does the home care side of the industry kind of, to use one of your terms, plug that hole? of being able to do that effectively for families?
Well, here's what I'll say to that. We, as a home care company, operate in most of the high-end private assisted living and long-term care facilities in Calgary. And what that represents to us in the marketplace is the fact that even when patients, some of them very wealthy, are going into these facilities, they're still paying an outside provider to take care of them when they're in the facility. And what we observe is that these facilities actually don't deliver healthcare that efficiently at all. And I'm not here to criticize them in terms of what they do or don't do. But this is our observation that even when you go to a facility, you still need to hire outside help. One of the reasons for that is the fact that healthcare as an industry has a lot of difficulty attracting and retaining high quality people. That's kind of the underlying market deficiency in healthcare in general. We all hear that in every aspect of the news and what we experience as healthcare consumers. And that's one of the things that we're trying to change as a healthcare company, which is treating our people differently, giving them value, rewarding them and remunerating them appropriately, and giving them autonomy and career development opportunities. And that's why, as a provider of healthcare services, we can actually do it better than larger organizations than us. And the second piece that you pointed out there is this notion of the social benefits of being in a congregate living environment. And that is not to be denied at all. And to be clear, patients often ask me, when should I go to a facility? And or when they're asking me this, they're usually not talking about long-term care. They're talking about a retirement home, aka an assisted living facility. And my answer to that question is, if you want to. So some people just want to be or enjoy being in that type of environment. And if that's you, then you should go to this sort of place, because I have seen it many times before that a person's life can be dramatically improved by going to a place where it's much easier to meet your peers and your neighbors because they're literally right next door to you and there's dozens of you around. So if you want to, then going to an assisted living facility is great. But there's also people that don't want to. Some people are just natural introverts. And also, they don't necessarily thrive in that type of environment. So when we work in these environments, we observe that a lot of our patients are actually just as isolated when they're in a congregate living facility as they were when they were outside of it. And actually, the main way in which they get their social stimulation and cognitive stimulation is with one-to-one care provision by a healthcare professional. And that's when they really get the value of being with another person, someone who's engaging with them directly and taking them out, doing things, sometimes pushing them to do so when they otherwise wouldn't. Patients in their 70s, 80s, especially 90s do have a natural sort of tendency towards apathy, where they need more to push them out of getting out of their chair, getting out of their room. And friends and contacts won't do that, but a professional home care provider would.
So really, as much as you talk about, not to put words in your mouth, of course, but as much as you talk about home care, you actually plug, again, geez, I'm using this term too much. You got me onto it, but plugging the whole of the system as well by working within these facilities and helping out people and just giving them that enhanced level of care, companionship, whatever the situation may be, that can complement what's being offered in these facilities. It's not just really home care. Well, I guess it is their home, but it's not just what you'd say traditional home care like the family home. It is their home and you just coming in and providing the service for them.
Yeah, we do that. And a lot of what we do is complementary to what the health system does. And so it's these things are not working, they're not trade-offs. They're very much complementary. Helping the health system helps individuals, it helps families, it helps care providers, and it's a positive flywheel in our experience and in our conception of what we believe home care to be, which is a way to help patients as well as help our health system by keeping them out of facilities where possible.
Yeah, 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 yeah. No, that makes sense. I was going to say something political, but I won't. Um, so, um, so you know, I mean, obviously you guys are a little bit unique. You're positioning yourself as unique in the marketplace. There's a lot of competitors, things like that. So a lot of choice, let's just say. from your kind of experience, obviously, before you started the company, you probably did a ton of research, not only your experience, as a physician, but just research in general. And then, of course, running the company and having real life examples. But what should someone look at, whether it's a family member or the person themselves who may need the care? What should they be asking or looking for in a provider? Because you
Mhm.
hear whether it's on the TV being advertised, situations like this where I'm talking to you and somebody might think, oh, well, this Charles guy's a really good guy, but what should I really be asking him about his company that I know whether they're a right fit for me?
Yeah, thank you for asking this. We get this question all the time: is how are we different from the other company that they've heard of? And maybe this is a little bit biased or maybe even arrogant of me to say, but I just don't think we're comparable to a lot of the other companies out there. I don't consider these other companies to be competitors of ours. We offer a very different service. So the question that I would ask if I was in a position of looking for care for myself or for my loved one is I would ask them, what would you do? What would you, the care provider, do in the event of this complication or this problem to do with my mom or my dad or my spouse? And by this problem, I mean if your loved one has Parkinson's disease, or if they have bad osteoarthritis and they have trouble walking, or they have dementia, you probably are aware of some of the complications and the things that can happen in those diseases. Ask your care provider. If my dad has Parkinson's and he has a fall, what would you do? If my mom, who has multiple sclerosis, has a fever, what would you do? If my dad, who has dementia, starts wandering at night and trying to leave the house, what would you do? And you will get an answer that will tell you whether or not you want this person or this organization to be in charge of their care. And my perspective is that if you ask pretty much any other home care provider in the city what they would do in the event of essentially a medical complication of a medical disorder, their answer to you will be, well, we'll have to call 811 or 911. And why do I believe this? Because I've worked for 10 years in an ER seeing patients where their home care provider has called 811 or 911 and they've ended up in front of me after waiting 8 to 10 hours in the ER for their very minor medical complication that we would otherwise have solved in their home. And so that's my very biased answer to your question, Scott. Thank you for asking.
Yeah. Okay. Um, when you look at the industry and see where it goes, I'm asking you to use a crystal ball here, but and again, we won't get into politics, but where do you see your industry going in the future? Like what, there's an evolution. Obviously, you're unique, I would say, and you kind of said, you don't have a lot of what you would consider true competitors because it is a unique offering. But where do you see things going in the future with home care or with seniors care, that type of thing?
Well, what we've seen from even our what would someone can call our competitors is that everyone is looking to expand home care to the greatest extent possible because the demographic curve is telling us that there is no physically possible way to house all of the people that we expect to need, again, need in quotes, a facility in the next 10 to 20 years as our certainly our current seniors, the current cohort of 80 to 90-year-olds. I don't know if they have a generational name, but as Gen X gets older, or the boomers get older, and the Gen X is looking after them, there will be no space to put these folks, and so they will have to be at home. And so home care as an industry is going to explode. And we really hope that medically supervised home care can be the answer to this problem, because the alternative of letting people languish until they receive or experience complications to the point of needing ERs and things like that is just going to end up in not only massive unsustainable expenses to our public health system, but also just untold indignity and suffering by our patients and family members, which is the even more important thing.
Mm.
So yes, I think that this is going to grow. We're going to have copycats. I welcome it. I really am passionate about helping people at this stage of life, and I welcome others who are interested in doing this to reach out to me so you can reproduce it in your own city, or even in Calgary for that matter, because there's more work here to do than I can possibly do.
Mm.
And we've had reach outs from numerous private equity firms and even large home care companies to expand or acquire our services, which we've resisted so far, but we hope to be able to scale our operation to help patients from coast to coast in the future.
Excellent. So, last question I have, because I've kept you a long time, and I know from knowing you a little bit, you're insanely busy, and how you're able to juggle all your things is quite amazing. But how does someone know whether, again, it's a family member or, in your case, your client yourself, how do they know whether when they need your services?
That is a great question. Most of the people that we talk to about our services are the caregivers of the patients that need the services. So it's usually the person who's doing the work of looking after a patient that will be the one to identify this. So, but just by the nature of the most common disease that we look after, which is cognitive impairment or dementia, the individual themselves will be sometimes completely unaware of it, if not less aware of it than they ought to be or are able to be. And so, if you're a caregiver, if you're a spouse, if you're a daughter or a son who is looking after someone with dementia or chronic disease, and you are starting to experience burnout. And burnout has a lot of definitions. It's a term that's almost thrown around too much and overused. But when it comes to caregiving for seniors with dementia and chronic disease, I actually find that it's a very apt term that's underutilized. If you're finding yourself giving up your personal life, your social activities to the point, and this nobody says this out loud, but I say it for them and I let them agree with me, to the point that you either resent or fear or don't look forward to seeing your loved one because you know that it represents more work, more stress.
Mhm.
Oh my gosh, what am I going to find when I go to their home? What needs to be done? What are they going to say to me? Once you start to feel that, that's the right time to start to bring in professional assistance to walk you through that process because it doesn't have to be that way.
Great. Yeah, good answer. You answered the questions very well, very honestly. It's almost as if you've been asked them before. And by the way, not from me. I don't do any sort of pre questioning or anything ahead of time. So yeah, Charles, thanks very much for agreeing to do this. I think, like I said, I'm getting a lot more questions, and it's interesting with us. We're getting questions, yes, from our clients who are realizing that they're maybe in need of a service company like yourselves here soon, or at least thinking about it. But we are also getting a lot of questions for some of our clients who are dealing with their parents or even their grandparents on next steps. And I would agree, they definitely see their the key caregiver, which is usually the person with the long-term illness spouse, struggling, and the kids step in to say, "Hey, we need to deal with this because mom or dad is not doing well here, looking after their partner." So I hope that even just talking about it and letting it out there on what's going on in the system will help people at least start a train of thought to see that, oh, well, maybe a service such as yours is a benefit and something to be looked into and researched more, as opposed to just assuming that the system will take care of everybody. So thanks again for taking the time to do this.
Thank you, Scott. Thank you for your questions and for having me. I appreciate it.